My name is Dewey Baldwin, and my wife and I are here from Kingsport, Tennessee. And we come to the RAM Clinic, and they cater to the uninsured and underinsured. And my wife and I fall in the category of both. She is uninsured and I'm underinsured. So we come for vision and medical. We will be sleeping in our car here tonight, as well as a lot of other people I see around us here. We'll be seen by the people here tomorrow, starting at 5 o'clock in the morning.
In 2018, for the 19th time, RAM and its local community partners, led by the Health Wagon, held a clinic expedition in Weiss County, Virginia. For 3 days, medical, dental, and vision care were provided to anyone who registered at the front gate. Before the clinic got started, hundreds of volunteers worked to set it up and then celebrated.
Stan, would you like to say a word about when you first met Sister Bernie King?
I certainly would, and I'll never forget the day. It was at Mountain City exactly 20 years ago, and Sister Bernie came to one of our events as a volunteer, as she's did all of her life, and of course with Teresa Gardner, the two of them came and said, can we ever bring this organization, a clinic to Southwest Virginia, to Weiss County in particular? And I said, of course. But in the case of these two young ladies, they made sure that it was going to happen. It's been my pride and joy to work with these two ladies.
If you have a number in hand and it's got a number that is below 250, please move forward. Okay?
Second stroller come through with no little kid.
290.
When patients arrive the night before the clinic, they are given a number ticket for entry the next day. They'll sleep in the parking lot until the gate opens at 6 a.m. Even before the sun came up over the fairgrounds, hundreds of patients had checked in and were keeping out of the rain in the grandstand used for the horse show and fair every June.
Well, first off, we always offer medical, vision, and dental. Dental, we're doing cleanings, fillings, extractions. Vision, complete eye exams, looking behind the eye for any disease, and patients can pick out a pair of frames and have their glasses made on site.
What do you think?
This clinic is it's larger in the medical area than a standard clinic. 19 years, ongoing here in Wise. A large amount of specialties has been pulled into this clinic. In addition to just general health exams and women's health exams that's available, there's a mammogram bus. They can have ultrasound. They can have EKG. There's cardiologists on site, dermatology, plastic surgery. There is a chest x-ray tractor trailer that is run by a pulmonologist, and he also specializes in black lung, which is very prevalent in the Virginia area.
As the list of services at the clinic shows, many different needs can be met during these 3 days. Hearing tests, a session with a chiropractor, health information, testing, and training in Narcan to revive patients who have overdosed on opioids. Virginia's initiative to deal with the opioid crisis, called Curb the Crisis, was there to get information into the community.
In addition to those services, we have lots of vendors that are offering free clothing, school supplies, just a large variety of things. We also have Aetna Health Insurance, who are providing food boxes as the patients exit the fairgrounds.
Actually, it's full of toast. So I walk like a country mile to
We're sitting here right behind me. Here last year we said, you know, these people are really needing more than just the health care they get here the once a year. What else can we do? And so we put together a national partnership with Feeding America. We explored those relationships. So we have Feeding Southwest Virginia here now. We did a grant to them to be able to provide one food box per family that leaves the RAM event to add a little something more so people can go home with some food. We like to talk about what's called the social determinants of health. So if people aren't taking care of those things first, they're probably less likely to take care of their health care if they're not eating well and all of those other things. So we wanted to do that as well. So this is the first year we've done that.
Work in food insecurity, we've known for many years that if people don't have adequate nutritious food supply on a consistent basis, they're not healthy. A lot of the reports we've done over the years has said we have high percentage of our people that are getting food that have high blood pressure and type 2 diabetes. So we've known that connection for a while. What's exciting is healthcare has now recognized the fact that if they can give any care at all in a clinic, like this clinic or somewhere else in a doctor's office, but if the patients go home and they don't have anything to eat, then they can't get well, they can't recover, and they can't stay well. So this has been an exciting opportunity for food banks and for Feeding America Southwest Virginia as we strategize and talk about what does that mean, what kind of partnership would be most helpful and meaningful to the families that we serve and the patients that they have.
Our employees live here. We have members that live here. We have potentially more Aetna Medicaid members coming on board. Virginia has now enacted to expand Medicaid. That hasn't happened yet, but there's a lot of people here that would benefit from that Medicaid expansion that we hope would choose Aetna. It's important for us to be truly kind of woven into the fabric of the community that we live and work in. You see some of our group up here now will have over 30 volunteers as in addition to our financial commitment. We have volunteers from all over Virginia and actually from all over the country coming here this weekend. So we are glad to be a part of this. We've been a part of this for a long time, and we want to continue being part of it for a long time.
The Medicaid expansion, which I think is amazing, and I think it's going to be very beneficial for this region, for the people here. But you have to get them to a specialist. They have to get to a specialist because the specialists are not available here. But then you're expecting that we have transportation down here, and Uber doesn't exist down here. We have one bus transit system that serves 4 counties, and you know, if you were to look at the population, I mean, you just can't do it. Right. And so with this lack of transportation, you have people who can't make it to specialists, they can't make it to doctor's appointments, but they also can't make it to be employed. Right.
We were sitting right here very early in the morning, about 5:30, 6 o'clock in the morning, and a gentleman came kind of limping down the asphalt with just one shoe on, and his other foot was swollen and barefoot. And so we sat him down right here, kind of right where you're sitting right now, and said, got him ready to go get his medical care. But then we also asked him if we could find a shoe in the size that he might need with the foot being swollen. So thanks to the great efforts of everything that comes together here on site, there were clothes donated, which included shoes. We were able to find him the right size shoe, and then get him on his way to his medical care. And then I saw him later in the day, and he said, "Thanks so much for helping me out." So.
You know, seeing people here that camped out, laid on blankets, slept in their cars in the heat of the day to wait 5 hours to work through the process. And one lady had 6 teeth pulled yesterday, and she was still walking around getting other services after having 6 teeth pulled. And when she would come to get her food box, she was just so excited and grateful. So to see the compassion of all those physicians and medical people that are here on the scene with the Health Wagon and RAM and the other organizations, and then to be able to let those patients leave with food to take home, They saw people actually opening some of the product that we gave them in cans and eating it in their vehicles as soon as they got it. That says they're hungry. If they need medical attention and if they can't pay and they don't have insurance, then they need food.
Well, I do have health issues. I have emphysema, and my lung function is less than, actually, the last test I had was over 2 years ago, and it was less than 30% then, so I don't have a clue what lung function I would have right now. But the people here were gracious enough to get me oxygen for the night in case it's needed, because I left the house without my oxygen concentrator. So the people here are here to serve, and that's just a beautiful thing, you know.
And you have emphysema, but you quit smoking a long time ago.
I stopped smoking at age 36, and I'm 64 years of age now. And the doctors are sort of shocked that my lungs didn't rebound more than they did. They said, you know, quitting at that young age, I should not have been where I am today. But, you know, I had a dirty environment to work in all my life. I've, you know, breathed a lot of asbestos and paint fumes and welded on stuff I shouldn't have welded on, you know, galvanized stuff and painted stuff. We take our health for granted, you know, when we are healthy, and we subject ourselves to things that we should not do.
For nonprofits in Southwest Virginia, like the Health Wagon, Feeding America Southwest Virginia, and Family Crisis Support Services, being there for the RAM Clinic is just part of their year-round commitment to the community.
So RAM is wonderful. It comes in, it's here for the 3 days. A lot of people, you know, receive the health services, the dental, the vision services, and then it's over. And there's follow-up. There's maybe an appointment with a specialist. There is, you know, the need for continuing medication until they're set up on some kind of pharmacy plan, or just other things that may be needed. And we provide the financial help through private donations to the agency to help our community, to help our people here. And we serve the five counties in this region of Southwest Virginia, which is Wise County, Scott County, Lee County, City of Norton, and Dickinson County. We provide services for those living in poverty, those that are homeless, victims of domestic violence, victims of sexual assault, trafficking, and just addressing the needs of the community that other agencies can't assist with.
RAM clinics, like this one in Wise, requires local community partners, extensive planning, sponsors, and volunteers. Many volunteers.
We typically like for a community host group, which is what we call the group of local providers or local residents in a community that come together to put this clinic together. They're on the ground, they do the legwork, they know the local providers. So the community host group usually has a 12 to 18 month planning period. So the planning for a WISE event starts the day after the last day of the clinic. So on Monday morning, July 23rd, this community host group will start looking forward to next year. There's a lot of logistics that take place. The fairgrounds here has just been wonderful to work with the Health Wagon, who is a partner of RAM, and they are also the community host lead for this community.
Volunteers, from what I hear, and I've spoken to several of them actually, they're from all over. Knoxville, I talked to people from Knoxville, Tennessee, and of course from Connecticut, from of course Virginia, Tennessee, Radford, Virginia. The volunteers come from everywhere. It's it's beautiful that, you know, that people will come and give up their time and resources to help people like my wife and I.
Total number of volunteers at this clinic is probably close to 2,000. That includes setup day on Thursday. Today, I believe we had just under 500. Tomorrow on Saturday, which is the largest day, there are over 1,000 on that one day only.
Right.
Sunday, there's over 700
Right.
that's registered.
Yeah.